Now let's discuss something about the femoral sheath. The femoral sheath basically is a prolongation of two fasciae of the abdomen into the upper part of the thigh. One is the fascia transversalis and the other is the fascia iliaca. This femoral sheath encloses the femoral vessels, which include the femoral artery and the femoral vein, and also some lymph nodes. But the femoral nerve lies outside the femoral sheath. Now, before we understand the femoral sheath, we need to know where these two fasciae, the fascia iliaca and fascia transversalis, are coming from. Now, let's try to understand the orientation of hip bone in this diagram. This part is the anterior superior iliac spine, which on the hip bone is over here. This is the iliac crest, which on the hip bone is over here. And this part is the pubic tubercle, which is here. And this is the pubic crest, and this is the pubic symphysis. And pubic symphysis will be formed here if the other bone is also present. Now you can see this is the attachment of the iliacus muscle, which comes from the iliac fossa. This is the mark showing the attachment of the iliacus muscle. These three muscles are the muscles of the abdominal wall, the external oblique, the internal oblique, and the transversus abdominis muscle. So this transversus abdominis muscle is attached to the inner lip of the iliac crest. This portion, this is the inner lip of iliac crest where the transversus abdominis muscle is attached. This is the psoas major muscle, which is coming from the lumbar vertebrae. And this thing is the inguinal ligament. The inguinal ligament is attached to the anterior superior iliac spine above and to the pubic tubercle below. This is the anterior superior iliac spine and this is the pubic tubercle. So this is the attachment of inguinal ligament. So fascia iliaca is basically the fascia which covers the iliacus muscle and also the psoas major muscle. So it's a fascia which comes down like this, and as these two muscles are passing behind the inguinal ligament to reach the upper part of thigh, so the fascia will also pass behind the inguinal ligament and it will be attached to these muscles and it will go in the upper part of thigh. Now you can see the femoral vessels. These two vessels, this is the abdominal aorta and this is the inferior vena cava. This is the common iliac artery, which is dividing into external and internal iliac artery. The external iliac artery continues in the upper part of thigh as the femoral artery. You can see that this external iliac artery is lying anterior to the iliacus and psoas major muscles. So this artery will also be lying anterior to the fascia which is covering these two muscles, which is the fascia iliaca. So if the fascia iliaca passes from the passes on these muscles into the thigh, these vessels will be lying on the fascia. That means the fascia will be lying deep to these vessels. Now this muscle is the transversus abdominis, the inner side of the transversus abdominis. And the inner surface of this muscle is covered by a fascia which is called the fascia transversalis. The rest of the muscle from the anterior abdominal wall has been cut. So you already know that the attachment of the transversus abdominis extends onto the inguinal ligament and eventually it forms a conjoint tendon. So when it comes on to the inguinal ligament, obviously its fascia, the transversalis fascia, also joins it and it comes behind the inguinal ligament. But the aponeurosis of the muscle, it is limited to the inguinal ligament. But the fascia transversalis extends a few centimeters into the thigh behind the inguinal ligament. So as this muscle will be coming here and the vessels, the femoral vessels are lying behind the inguinal ligament. So the fascia transversalis will be lying anterior to these femoral vessels as the fascia transversalis is passing just behind the inguinal ligament. So it will be lying anterior to the femoral vessels. So now you know the fascia iliaca is lying posterior to the femoral vessels and the fascia transversalis is lying anterior to the femoral vessels. In this way, this fascia, the two fascia which are forming the femoral sheath, They will basically enclose the femoral vessels, in which the fascia transversalis will be lying anterior to the vessels and the fascia iliaca will be lying posterior to the vessels. As we'll move further, we will know that the femoral sheath encloses the femoral artery and the vein, but the femoral nerve stays out of the femoral sheath. The reason of this is that the femoral nerve is a branch of the lumbar plexus. The lumbar plexus of nerves arises from the lumbar spinal segments of the spinal nerve, that is from the L1, L2, L3 and L4. As these nerves, the anterior primary rami of all these nerves emerge from the intervertebral foramina, they will enter the substance of the psoas major muscle. These are the nerves, and they will enter the substance of the psoas major muscle, and the lumbar plexus basically is formed inside the substance of psoas major muscle, so it is not visible here. You can see on this side the psoas major has been cut, so you can see the lumbar plexus which was present inside the psoas major muscle. So the femoral nerve, as the lumbar plexus is present inside the psoas major muscle, the femoral nerve also is formed inside the substance of psoas major, and it eventually emerges out of the lateral margin of the psoas major, and you can see it in the gap between the iliacus and psoas major. This is the femoral nerve. So as it was inside the psoas major muscle, and as it emerges out of the psoas major, it will remain behind the fascia of the psoas major muscle, which is the fascia iliaca. So as the fascia iliaca covers the iliacus and the psoas major, it will pass anterior to this nerve. So this nerve will remain behind the fascia iliaca. Now fascia iliaca was already forming the posterior wall of the femoral sheath. So the femoral nerve will remain behind the posterior wall of femoral sheath, so it will lie outside the femoral sheath, not inside it. Only the femoral vessels and some lymph nodes will be present inside the femoral sheath. Now this is a man in which I have tried to show the inguinal ligament and I have shown the femoral sheath. Now we will take a sagittal section of the person which will pass from this part of the femoral sheath, and we will see it from this side. Now this is the sagittal section of that person, and this is the anterior abdominal wall, and this is the iliac crest. This muscle is the psoas major. This is the iliacus muscle arising from the iliac fossa. This is the external oblique, and the lower in-turn portion of the external oblique is the inguinal ligament. Then is the internal oblique, then comes the transversus abdominis, and behind that transversus abdominis, I have shown with yellow the fascia transversalis. This yellow structure, which is covering the psoas major and iliacus, is the fascia iliaca. So this portion, this is the femoral sheath, in which it is formed by the posterior wall of which is formed by the fascia iliaca, and the anterior wall is formed by the fascia transversalis, and you can see both these fascia extending down into the thigh below the inguinal ligament. Now let's try to understand this diagram. In this diagram you can see the upper part of the thigh. This is the pubic tubercle. Somewhere over here will be the anterior superior iliac spine, and this structure is the inguinal ligament. This is the sartorius muscle. This muscle is the gracilis. This muscle is the adductor longus. This muscle is the pectineus. And this is the psoas major coming down here, and this is the iliacus muscle which is coming down over here. Now this structure which is lying behind the inguinal ligament is the femoral sheath, and you can see it extending a few centimeters below the inguinal ligament into the upper part of the thigh. So between the anterior and posterior walls of the femoral sheath there are two septa. These septa divide the femoral sheath into three compartments. The most lateral compartment is the arterial compartment, which contains the femoral artery. The middle compartment is the venous compartment, which contains the femoral vein, and the most medial compartment is also called the femoral canal, and it contains lymph nodes. The arterial compartment also has a nerve with it, which is called the femoral branch of the genitofemoral nerve. Genitofemoral nerve is a branch of the lumbar plexus, and it divides into two branches: a genital branch and a femoral branch. So the femoral branch of that genitofemoral nerve accompanies the femoral artery in the arterial compartment of the femoral sheath. And you can also see the femoral nerve over here, which is lying behind the fascia iliaca. As we have already discussed, why is it lying behind the fascia iliaca? So it will lie outside the femoral sheath, not inside. Now the upper opening of this femoral canal is called the femoral ring. This structure is called the femoral ring. Now if we try to see the boundaries of the femoral ring, we can clearly see that anteriorly it is bounded by the inguinal ligament. This is the inguinal ligament. Medially, it is bounded by the lacunar ligament, which is an extension of the inguinal ligament onto the pectineal line. So this structure is the lacunar ligament. Laterally, it is bounded by the septum, which is separating this compartment with the venous compartment. And posteriorly, as you can see, this is the pectineus muscle. So posteriorly, it will be bounded by the pectineus muscle along with its fascia. Here is another diagram to show you the boundaries of the femoral ring. This is the pubic tubercle. This is the anterior superior iliac spine, and you are looking at the outer surface of the hip bone. This is the inguinal ligament. This structure is the anterior inferior iliac spine. So this is the iliacus muscle, which emerges from the iliac fossa and comes out into the thigh, passing behind the inguinal ligament. This is the psoas major muscle, and this is the pectineus muscle. This is the femoral nerve lying behind the femoral sheath. This is the arterial compartment having the nerve, the femoral branch of the genitofemoral nerve along with it. This is the venous compartment containing the femoral vein, and this was the femoral canal, and you can see the boundaries of femoral ring over here. Anteriorly, it is bounded by the inguinal ligament. Medially, it is bounded by the lacunar ligament, which is the extension of the inguinal ligament onto the pectineal line. Posteriorly, it is bounded by the pectineus and the fascia covering the pectineus, and laterally, it is bounded by the septum, which separates it from the venous compartment of the femoral sheath. Now, coming back to this diagram, I have drawn another structure over here. This yellow structure or orange structure is the fascia transversalis, and behind this I have shown you the peritoneum. Peritoneum is the structure which is lining the inner surface of the abdominal wall. So this structure here is the femoral ring. So the peritoneum covers the femoral ring on the superior aspect. This femoral canal and the femoral ring, they form a weak space from where the abdominal contents can pass and enter the thigh, and this abnormal protrusion of abdominal contents into the thigh is called a femoral hernia. Now the peritoneum, which is covering the superior surface of the femoral ring, it dips down into the femoral ring, and that structure is called the femoral fossa. Femoral fossa is basically the peritoneum dipping down into the femoral ring. It is similar to a cloth placed on the surface of a glass, and it tends to dip inside due to the effect of gravity. This was all about the femoral sheath. Please give your suggestions in the comment section below so that I can improve my videos. Thank you.